Hi everyone, thanks for joining me today. It's Wellness Wednesday, and today we're talking about a very important topic, one that I'm really passionate about and I see a lot of in my office, and that is birth trauma and post-traumatic stress disorder that can result from birth trauma in the postpartum period. So when I think about birth trauma, I think of this first and foremost as a subjective experience, that we're often told that if our baby is healthy, that everything should be fine, that we should feel grateful for that, and that's all that matters. When in truth, that's not all that matters. And what happens is that when we're told that as mothers and we feel like we've had a traumatic experience either prior to our birth experience or resulting from giving birth to our baby, that we then kind of stuff those feelings or feel like already that those are not valid, that there's not a space to be able to talk about those, that we should just feel grateful that we've had this healthy baby and that we both made it through kind of okay. There's this coin that's termed in trauma, and that's that trauma is in the eye of the beholder, which essentially means that trauma is subjective. That if someone comes into my office and they say that they've had a traumatic experience, or that there's some aspect of their birth experience that they deem to be traumatic, then it is traumatic. It doesn't have to meet this medical criteria for what trauma is. PTSD, on the other hand, which we'll get into in the video, is something separate from that, and that there's certain markers or symptoms that we look for that are diagnosable for post-traumatic stress disorder. But let's first start with birth trauma. That this is something that a lot of women experience, and it's not necessarily because of something medically traumatic that happens within the birth experience with your baby. That I see kind of three different things that happen with birth trauma. The first is a previous trauma or a previous existing post-traumatic stress disorder that the mother is then coming into the pregnancy and labor and delivery experience with. And so what happens is that when another trauma results, it kind of stirs up that old trauma, and then it becomes much more complex. So let's say if a woman has experienced a previous sexual assault or has experienced sexual abuse in her childhood, or another traumatic event that she might be holding in her body, that can then be ignited from having a baby. So that's the first thing that we see. The second is during the labor. So that's what oftentimes people will talk about and refer to. So if there's some traumatic element to the labor experience, often unexpected. So if the mother ends up having a C-section, that's not something that she had expected or planned for, that element alone can feel traumatic for the mother. If there's a use of forceps or a vacuum during birth, that can be very traumatic for the mother. If there's a prolapsed cord, that can be really scary. If the baby ends up unexpectedly being sent to the NICU, that all of these are kind of traumatic elements that can happen in the labor and delivery experience that a lot of mothers can experience as being traumatic. And that oftentimes there's not this space that's created to be able to process any of that. There's not these a check-in about, hey, let's talk about this. What was this like for you? Or even at that 6-week OB follow-up appointment or follow-up with your midwife, that sometimes there's not this space that's to be able to talk about how you experienced your labor and delivery experience. And if there is something that's sticking with you that you might feel was traumatic, that it's I even hear OB and sometimes midwife providers speak to this and say, well, at least the baby is healthy, or you're okay. You kind of walked away from that. But we walk away from these births with scars, and not just the physical scars of birth, but also these emotional scars that we carry with us, and needing to have the space in order to process those. The third that I hear about probably the most in my practice is these kind of traumatic experiences where the woman is not feeling cared for in her labor and delivery experience, that she's often felt talked at and talked about as opposed to feeling talked to, that she's sometimes feeling invisible in the room, and that her feelings and her experience are not considered, that it's just focused on healthy baby, healthy mom from a medical standpoint, and discounting the psychological and emotional impact. Essentially this basic foundation of relating to each other as human beings and what this experience must be like for that mother. And then oftentimes these healthcare providers are carrying their own traumatic experiences with them, of witnessing what they may feel was a traumatic birth experience. And there's not this space for them to be able to process that with their colleagues or individually. It's just kind of, oh, this is the work that we do, and it's kind of glossed over. And what happens is that the way in which those providers are then relating to these mothers in those labor and delivery experiences is that other trauma is getting stirred up for them, and or this traumatic experience then is getting kind of added to what they were already carrying with them. So it becomes kind of this recipe for disaster, for lack of a better word. And when I see someone come into my office who's experienced what they feel is a traumatic birth experience, that it's really important not only to hold space and to be able to have that mother share her birth story and to validate her feelings and her experience, but to really meet this in a very holistic way, to be thinking about her as a whole person and what would be most helpful for her in her healing process. So if that's in addition to psychotherapy, her receiving any type of body work that we hold trauma in our bodies, so maybe yoga, trauma-informed yoga practice, or dance therapy. Some people find art therapy to be really helpful, some way to be able to express this, that oftentimes when we're feeling really traumatized, that sometimes it feels hard to put some of that experience into words. In addition to that, exercise, eating well, caring for the mother as a whole person. So that's what I think about when I think about birth trauma and kind of how I look to treat birth trauma. If there's something that the mother is really getting stuck on, and there's kind of this she's having these is having post-traumatic stress disorder and the symptoms that come with it, such as the flashbacks or nightmares, or finding herself avoiding the stimuli that's associated with her birth experience. So avoiding the hospital, avoiding maybe if a thought or a memory comes to mind from that birth experience, quickly kind of going away from that, or not wanting to talk about her birth experience, kind of glossing over it, anything to kind of keep that trauma at bay. Anxiety and panic attacks I'll see also with post-traumatic stress disorder. And this feeling of detachment, as I said, this way in which the mother might be surviving and kind of making it through by separating herself as much as possible from those traumatic, from the trauma and the feelings and thoughts that are associated with that experience. So if I find a mother who's really getting stuck on this and is having these traumatic experiences really impede her day-to-day life, and that psychotherapy alone, as well as the holistic practices that I was referring to, if that doesn't feel helpful in kind of the healing process, something that we may also want to add into addition to that is maybe some EMDR treatment, or looking elsewhere to really be able to support that mother as best as we can. But I think the biggest takeaway from this video is first to acknowledge that birth trauma happens, and that it doesn't have to necessarily be tied to this medically traumatic experience that the mother has experienced in that labor and delivery. That it can be these emotional scars that we carry with us. And that this happens for our partners that are in the room with us as well, them feeling invisible, them witnessing what might feel traumatic for them, seeing their partner in pain, having something unexpected happen, or feeling, not feeling visible in the room and feeling this helpless and out of control feelings that come along with that. So those are some of my thoughts on birth trauma. And I could go into this more and more, but if you feel that you have had a traumatic birth experience, please reach out for help. That so many people experience this, and so many find psychotherapy to be beneficial, to be able to have this space to process this in a way that feels healing for you. And I'll look forward to talking to you all again next Wellness Wednesday. Take care.